Basically, too much exercise is bad for your health.
Okay.
Most of what determines your health has nothing to do with what happens in the hospital. It happens before the hospital, right? Before you get to the hospital. So the social determinants of health are defined by the conditions in which we are born, grow, live, work, and age.
Dr. Aseem Malhotra is a world-leading British cardiologist, health campaigner, and author. He was the first science director of Action on Sugar in 2014 and was listed as one of the Sunday Times 500 most influential people in 2016. Dr. Aseem is also the co-author of the groundbreaking book, The Pioppi Diet.
If you are, for example, in a low pay, low control, high demand job, that can be more damaging to your health than being unemployed. This is one of the most prescribed drugs in the world, estimated to be prescribed between 200 million and 1 billion people, okay? Most of those people are not going to get any benefit at all, and they're not told that. The one problem right now with our diets and populations is that
it is believed that if you drink a glass of red wine a day, just one, it's going to be good for your heart.
Yeah.
Is that the myth? Is there a correlation in between having regular sex and our heart health?
Okay. I think the first thing is,
I've taken the mRNA COVID vaccine. What was so wrong about it that you needed to speak publicly about it?
I think
most of us were going to suffer from stress in one way or another because it's relative.
Yes.
So once we are in that situation, how can I get out of it?
Yeah, really good question. I think
Dr. Malhotra, you are probably one of the world's most recognized doctors, cardiologist. You've been campaigning heavily on public health issues, which include obesity, general health. For those who don't know you, can you share a little bit further your professional background that allows you to speak about this subject matter?
Yeah, thank you, Alberto. Thank you for having me. And also, please call me Aseem.
Aseem.
You don't have to be formal. I mean, that's actually part of one of the things that I try and promote and advocate is something called shared decision-making with patients so that patients don't feel that doctors are so patriarchal, really to get more on their level. And I think they're more comfortable having conversations. So that's also part of my philosophy and ethics when it comes to patient contact. So I am a consultant cardiologist. I grew up in Manchester. I went to a school with, and I'm mentioning this because I think we are all shaped by our experiences, by the people we meet, by our family, by culture, the way we're brought up. And the school I went to, called Manchester Grammar School, which is a very well-known, prestigious school, the motto of the school was in Latin, sapere aude, which means dare to be wise. And it's a school that encouraged critical thinking. And always actually, although it was, certainly when I was there, it was the number one school in the country for, examination success, whether it's A-levels or GCSEs, we were the number one. But it actually encouraged people to have a breadth of knowledge and experience of so many other things, whether it was excelling in sports, whether it was debating, whether it was, getting involved in communities, action or Amnesty International. So it was it gave me and students there, I think, a good breadth of understanding of the world, but also in particular, coming back to dare to be wise, it also, Einstein said, a foolish faith in authority is the worst enemy of truth. So that kind of almost concept was instilled into us. They wanted students to challenge the teachers, to ask questions. So I think that definitely had a shaping on who I am, as well as my background in terms of my parents. Both my parents were GPs in Manchester. And although they were doctors, they didn't sort of, I think, influence me to a great deal to pursue medicine, although I thought it was a very noble profession. But I grew up with values that were very much about the community comes first. Always, your primary duty is to the community. So that definitely shaped me. And then obviously in school, I really enjoyed debate and discussion. I actually, interestingly, wanted to initially pursue a career in law because I had a really strong sense of injustice, but I also had an idealized view of what law was, watching, TV programs, which is probably before your time, Alberto, something called LA Law, which was a very popular program. I hated injustice, but I also wanted to fight for those people that didn't have a voice. And ultimately, I changed almost last minute to pursue a career in medicine, partly because I had friends and relatives who were lawyers who said, family friends certainly, and relatives or lawyers that said, Aseem, just understand one thing. The current legal system is not so much about injustice, it's about winning. And then I decided to pursue a career in medicine. And of course, cardiology was the career I pursued, partly also, rooted in the fact that I had an older brother who died. So when I was 11, my older brother, who's 2 years older than me, who was 13, just after, we had birthdays very close together, just after our birthdays, he got sick with just a tummy bug. He had a Down syndrome as well, which also meant that his immune system wasn't, perfect. And within 5 or 6 days of getting this tummy bug, I'll never forget it. He started becoming breathless. My parents didn't really know what was happening. Even the pediatrician that came to see him thought it was just nothing major. And within 48 hours of becoming breathless, he was in hospital with crashing heart failure, had a cardiac arrest and died. So that had obviously a massive impact as me as an 11-year-old boy, losing my older brother, on my parents. No one should have to outlive their child. And I remember thinking at the time, speaking to my mum, and part of the way of me dealing with this is like, this shouldn't happen. Why is a young boy died of a heart issue? And that was really where I think I started to think if I was going to pursue a career in medicine, it was going to be in cardiology. So I went to, I was lucky enough to get, top grades in school, and then get, accepted into Edinburgh Medical School, which is one of the dream medical schools for me because it's the oldest medical school in Europe, and had a traditional course and was very well known. So I went to Edinburgh, and on that as well, one thing that's interesting, which I also teach when I was teaching medical students, I tell them this. One of and this influenced my thinking as well, is one of the most famous alumni of Edinburgh Medical School was Arthur Conan Doyle, who was the author of Sherlock Holmes. So Arthur Conan Doyle was a medical doctor. And what many people don't know is he modeled the character of Sherlock Holmes on one of his professors of medicine, who was an amazing diagnostician. And he would talk about the fact that he would sit in a consultation room as a medical student and observe this doctor who would start to make a diagnosis even before the patient has opened their mouth by looking at clues. So if a patient walks into the room, he would look at the shoes they're wearing, look at their hands, quickly try and figure out what kind of job they had, and already then start formulating in his mind what kind of disease are they more prone to and what are they likely to have before then asking questions to then make the diagnosis. So Sherlock Holmes, and the way that he would solve his murder mysteries, if you like, as a detective, the thinking is actually quite similar to how a doctor makes diagnosis. And one of the bylines of Sherlock Holmes is when in terms of trying to solve his murder mysteries, which is where you almost, can make a diagnosis in medicine, when you've eliminated the impossible, whatever remains, however improbable, must be the truth or must be true. So why is that important, Alberto? Coming to a broader concept we'll talk about later, is that 80% of the diagnosis we're taught in medical school, and this is true, if you're a good doctor, 80% of your diagnosis will come from the history, from the conversation with the patient, right? 80% of that so you will then start to formulate by asking questions because you know about different clusters of symptoms that then, will match with a disease. So that's what doctors are very good at and should be good at. And then 5% comes from examining the patient, 5% comes from simple tests, 5% comes from expensive tests. And in 5%, 1 in 20, you don't get a diagnosis. And often what that is something that just gets better on its own that you can't really figure out, but it doesn't fit with the disease process. So that was another obviously influence on my, the way I approach medicine and patients, thinking broadly. And then, I pursued a career obviously in cardiology. Cardiology is very competitive. You have to pass your postgraduate examinations quickly. And then ultimately ended up in London. And then I qualified from medical school in 2001. I became a fully trained cardiologist, consultant around 2013, 12, 13. And my initial training actually was in keyhole heart surgery, if you like, called interventional cardiology. So that's really passing wires and tubes to the heart using x-rays and injecting dye, either going through the wrist, the radial artery, just under local anesthetic, patient's awake, or through the groin, the femoral artery. Very neat procedure. You know, the actual diagnosis of the blockages, injecting the dye, doing that process takes about 20 minutes. Oh. And of course, if you need to then treat a blockage, usually in the setting of a heart attack, then, that can take obviously longer. That's what I trained in. And then I shifted, for lots of different reasons, which we can talk about, but I basically shifted more towards prevention because I realized that actually we have this huge burden of chronic disease, which had been creeping and increasing for the last few decades, along with the obesity epidemic. And I wanted to investigate and understand why was this? Why were we not really curbing heart disease in the way that we should be doing? It's still the number one cause of premature death in European men. It's responsible, cardiovascular disease, heart attack and stroke, about 50-50, is responsible for about 20 million deaths per year globally. So I wanted to try and play my role, first of all, in understanding the problem, the root cause of the problem, and then once I understood the root cause, to then offer solutions. And that's essentially, that makes up who I am. That's really my primary driver, my focus, and what I do.
Thank you. There are a few aspects that you've mentioned that I think are perhaps the most explosive moments in your life that have just allowed me to understand who you are and why you have built this character. So on one hand, you went to this school that it built a mentality of challenging things. You were not just a person that would be satisfied with an answer, even if that answer was coming from people that were professionals in a given field, but you would challenge it. And I think, and I'm very sorry for what happened to your brother, but I think that's a clear example on how you are you have a very different mindset to most other people, at least most other people that I met, because you were brought up in an environment in which both of your parents were professionals. They were GPs. They were in the medical industry or in the medical space. And when your brother suffers this very unfortunate event, a lot of people would have thought that there is nothing else that could have happened because my brother is living in an environment where everything could be immediately detected and analyzed because I live with GPs.
Yes.
I'm not living in a house where my parents are professionals, are lawyers, for example, that perhaps they can oversee some issues that are going on at home. So in your case, you still thought that, well, they missed it and they are my parents, they're my so-called or so-thought superiors. I still want to challenge that I can improve at detecting these things, which is not something normal for such a young person. And I think that allows me also to understand much better why you are the character that we see in the news or in other podcasts as this challenging doctor that wants to find the truth and to disseminate this truth to the general population. So thank you for that. That paints a much clearer picture. Now, I want to discuss about cardiology in particular and within cardiology, heart diseases. For the majority of the population, and I include myself in that basket, we know perhaps one type of disease, a heart attack. That's the most common known disease. What are the most important ones that I am missing here?
Yeah, so you've hit the nail on the head. I think coronary artery disease is related to heart disease. So that's really to do with buildup of blockages within the main arteries that supply the heart muscle with blood. Okay? So
that's the definition of a heart attack.
Yeah, so a heart attack, very specifically, is any death of tissue, of cells of the heart, we call them myocardial cells, heart cells, because of a restricted blood supply for a prolonged period of time. So that scar that develops, maybe tiny, it can be detected from a blood test as well, is called a heart attack, and it can be small or it can be big. So that's a heart attack.
And the difference in the magnitude is according to which artery is being blocked?
Absolutely.
Okay.
Absolutely correct. Where the blockage is, how long the blockage has been there for, as in before it's treated in an emergency situation, determines what area of the heart muscle is damaged. And then on a broad, and by the way, that's different to a lot of people think. So it's different to cardiac arrest. Cardiac arrest just means heart stopping. Ultimately, everybody has a cardiac arrest ultimately when they die. But a cardiac arrest, a cardiac arrest can occur because of lots of different reasons. It can be because of a heart attack. That's one of the most common causes. It can be because of a rhythm disturbance that happens, electrical disturbance in the heart. And that can be linked, again, to heart disease, but maybe other factors can happen as well, like even, having severe infection or having a toxin in your body. These can cause disturbances in the heart rhythm. And then there are other aspects to heart disease, which in cardiology and which include heart failure. So that is when the heart muscle doesn't pump blood to meet the metabolic demands of the body, usually because it's become weak. And it can become weak because of blockages that have developed over time. Mm-hmm. It can also become weak because of excess alcohol consumption. It can become weak because of a viral infection that attacks the heart. Like with my brother, we realized, it's interesting, we never realized what happened to my brother. There was never really a diagnosis given. Only probably almost 20 years later, I'm sitting in a clinic already as a cardiology trainee with a wonderful doctor called Lorna Swan, who is a doctor in what we call adult congenital heart disease in the Royal Brompton Hospital. I trained in Harefield Hospital, which is one of the top cardiac centres in London and in the country. And we did a clinic together. I was, getting experience in treating, managing patients who are basically born with a heart defect. It can be something wrong with the heart valves. For example, that's again another part of managing heart conditions. And I remember having this conversation with her. I said, "Oh, by the way, this is what happened to my brother." And she said, "Aseem, it sounds like viral myocarditis." And I thought, of course. So we had just a normal viral. This can happen, affects anything, I think, from 1 in 10,000 to 1 in 100,000 people. Random. You get a cold, okay, and suddenly, within a space of a few days or a couple of weeks, the immune system, for whatever reason, randomly will attack the heart and cause the heart muscle to have a problem. And in a third of those cases, often it gets better. In about a third, you have a bit of an issue and it gets better. A third will have some damage that then remains there for the rest of your life. And a third will actually die within a very short space of time. So that was how, interestingly, I realized, I was like, that's probably what happened to my brother, because, he died in 1988. October the 28th, 1988. I'll never forget that day. But, I think probably there wasn't maybe a good full understanding of viral myocarditis at that time. But now, obviously, we know that's probably what happened. So yeah, there are lots of different aspects of managing heart disease. Of course, I have expertise in managing many different types of heart conditions. My personal special interest, though, is in the coronary artery disease, is what is the big killer.
What I was thinking right now is that based on your answer, there could be so many different factors that are affecting our heart. There are so many different heart diseases. And also, at some point, our heart weakens and its performance is not optimum to carry the vital functions of our body. Now, when I think about the different organ and how do I identify as an average person at home that this organ is not functioning well, is because there's some pain to it or I feel like its performance is not optimum. Let's take the example of my stomach. If my stomach hurts for a prolonged period of time, that probably would indicate me that I should go and see a professional.
Yes.
My lungs, if perhaps I'm not breathing well, my breathing patterns have been changed for, again, a prolonged period of time, I might go and seek professional advice. But with the heart, I've never heard a friend say, my heart hurts or my heart beats very fast or very slow. How often should we go and get our hearts checked?
Listen, if you've got symptoms that are troubling you, that are worrying you, if you've got pain in the classic most worrying symptom that suggests underlying heart disease is if you've got a central chest heaviness that comes on either with stress or mainly with exertion, relieved by rest, that's predictable, that's coming consistently, that is when or goes up into the neck and the jaw or down the arms, that's classic concerning heart pain. If it's happening every so often as a one-off and is unpredictable, it's unlikely to be a heart. It's probably muscular, could be something else. So I think listen to your intuition about whether you need to get checked. I think in general, though, what I would say, Alberto, is, in terms of screening, and again, there's a big issue about what we call over-investigation, over-diagnosis. It's a whole medical industry, we'll talk about that later, which makes money on not good evidence, right? Plays on people's fears. It happens a lot in the private sector. People want to go and get checks done. And in general rule of thumb is you don't really need to be screened for any issues, unless, of course, you've got, for example, a very strong family history. Say that you have a relative that died in their 30s and 40s who's a first-degree relative, okay? Maybe you screen earlier. But I'll tell you, really, once you hit 40 is when you should definitely have a screening check. People can get it done earlier. It's very simple. There are really sort of 3 or 4 main, checks that need to be done, which are very simple, by the way, and very cheap, which is great, okay? It's not expensive. A blood test to look at whether or not what your average blood glucose is. This is how you diagnose type 2 diabetes, or something called prediabetes, which happens before you develop type 2, which can tell you at risk of type 2 diabetes, and that's one of them. High blood pressure, very simple. If people want to check their blood pressure, they can buy for £40 from Boots a blood pressure monitor at home. Just check that. You want your blood pressure to be within a normal range. Also from the blood test, you can look at cholesterol profile. Now, there is a conventional thinking and wisdom that high cholesterol is a risk factor for heart disease. I've essentially, through my research, through my publications, through my third book, which is called A Statin-Free Life, to a large degree, in a polite way, questioned that hypothesis. To put it less politely, completely demolished it as a risk factor for heart disease. I don't think that high cholesterol actually is a major risk factor for heart disease, although it's been the main focus, and we'll come on to that, of managing heart disease, and it's a $1 trillion industry, okay, which is still being sustained on flawed information. But within the cholesterol profile, there are 2 things that you measure which actually are relevant and are much more predictive of heart disease. One's called triglycerides and one's called HDL. HDL is known as high-density lipoprotein, is conventionally known as good cholesterol, okay? So those things you can check. You want your good cholesterol to be in a good high range, and you want the triglycerides to be, which is basically a fat in the blood, if you like, to be low. And then finally, those are the real, so type 2 diabetes, high blood pressure, what we call an abnormal cholesterol profile, an unhealthy cholesterol profile. Smoking, I think smoking consumption's gone down massively. I think only about 70, it's still not as low as we'd like. 17% of UK adults still smoke. That's definitely a major risk factor for heart disease.
That includes vaping?
Great question about vaping. It's an ongoing area of controversy. One of the people that I know very well who's researched this is actually one of the world's top vascular surgeons. So he doesn't operate on hearts, but he operates on blood vessels, either in the neck or in the legs that have become blocked for the same reasons, risk factors. He believes vaping is quite bad. And it makes sense that vaping, for me, there is some research that shows that what vaping does, it increases stress within the arteries and can maybe trigger heart attacks in people who've already got some underlying blockages. So I think vaping's a problem, personally. I think it's going to come out. More and more research is going to come out. Again, remember, the same industry that lied for 50 years, deliberately deceived people about tobacco being harmful, is also, their business model. We come back to the economic model in a minute. Their business model is to make money, right? All these big corporations make money in general through mass deception. So we really can't trust them to tell us the truth on it. There needs to be independent evaluation. But of course, they want people to get, as many people vaping as possible. I think, just to be nuanced about it, Alberto, just on the vaping issue, I don't want to throw the baby out with the bathwater here. I think one of the issues is you take, say, a product for like vaping, which may actually have an important role in a very subgroup of people who are really struggling to stop smoking. And it's like a way for them to kind of, go from smoking cigarettes to vaping to quitting. Okay. I think that's fine.
Okay.
But actually you see many people now who maybe have never even smoked, because of course the market business model is to get many. Listen, if you are, running a vaping company, your business model depends on getting as many people to vape as possible, doesn't it?
Does frequency matter as far as the heart is concerned?
In terms of?
Vaping, for example, or smoking?
Listen, in general terms, of course, yes. There's a dose response. Same with smoking. If you're smoking 20 cigarettes a day versus less than 5 cigarettes a day, massive increased risk compared to that, right? In fact, on that, and I'm not here to justify smoking, because I think, when we talk about sugar, one of the things people ask me about sugar being harmful, I say, well, 1 teaspoon of sugar won't kill you in the same way 1 cigarette won't kill you. Okay? But one thing that's very interesting when you look at the evolution of the understanding of heart disease in populations is that, in the 50s and 60s, there was a question as to why did Mediterranean countries have much lower incidence of heart disease compared to Northern European countries in America. Okay? And this is where the Mediterranean diet concept came in and started to be researched, and evidence suggested there was something in the diet. But diet from ancient Greek actually comes from the word dieta, which means lifestyle. So that was lost in the it then became just about food. But what was interesting, Alberto, is if you think about those Mediterranean countries, let's look back to, again, it's before our time, but it's extraordinary to think now. In 1970, 50% of adults in the UK and the US were smoking cigarettes. 50%. It's huge, right? I suspect, I don't know for sure, but the exact figure, but I suspect it was similar in European countries. The difference was, though, from research I've looked at, and I'm very happy to be corrected if someone has better information on this, is that the Mediterranean countries, they were also smoking, but not so much, maybe 4 or 5 cigarettes a day, yet they had much less heart disease. Now, was it because other things were counteracting it? A sense of community, the extra virgin olive oil, the sun exposure? Maybe. But anyway, to answer your question, yes, there's an issue with the dose, the amount you take, the amount you smoke.
So you hit 40.
And sorry, one more thing, Alberto.
Yeah.
So these are the conventional risk factors for heart disease. But actually, the root cause that drives the type 2 diabetes, that drives the high blood pressure, that drives the cholesterol profile to be abnormal, has never really been properly addressed. And that's something called insulin resistance. And that's your body becoming resistant to the hormone insulin, which is involved with fat metabolism and managing blood glucose levels to be in optimal range over a period of time. That is the primary driver, and that's not been refuted, okay, of heart disease. Of course, drives these other risk factors. Also, by the way, linked to, we'll talk about it later, chronic stress, okay? And you can very rapidly improve insulin resistance purely from optimizing your diet. But no doctor talks about it. Most doctors don't even know this concept, or if they do, they don't know what to do about it. And the model right now to prevent and manage heart disease is to basically give drugs for these risk factors rather than reverse it, which is what I've been doing with my patients, just from lifestyle changes. So this is the sort of big battle going on right now, is trying to shift the paradigm in medical practice and also the understanding of heart disease.
Are these risk factors affecting both men and women in the same way?
Yes, pretty much the same way. Absolutely. The only thing I would say is women tend to not develop heart disease. They tend to develop heart disease later than men because there seems to be some protective effect of estrogen. So after the menopause, that's when the rates of heart disease start to go up for women.
And should they change their lifestyle then?
I mean, I would recommend being on a lifestyle. Listen, you mentioned it, before we started the conversation, obviously before, which I love, is this is ultimately about how can we be the best version of ourselves, right? And that comes back to a definition of health, which I love, which actually came from the World Health Organization, who I don't love anymore, by the way, but I used to love the World Health Organization, in 1946. And their definition of health was a state of complete mental, physical, and social well-being, not merely the absence of disease and infirmity. Now, Alberto, let me ask you this question. What is more important to people in their life than that? I can't think of anything. What is more important to people? And if you look at international surveys, they always put health as number one. Understanding that complete mental, physical, and social well-being. I mean, that's basically how do we get to a level of authentic, sustained level of well-being stroke happiness, if that's the right word. That's what we're all trying to do, aren't we? So that's really, again, what my area, is really getting to the root cause of this. Because if you don't have that, you're going to be obviously at increased risk of heart disease and heart attacks.
I think at a fundamental level, everyone cares about their health. But unfortunately, I strongly believe that we live in such a consumer-oriented world that most people in developed countries, they prioritize other aspects in life on top of their health. And I also feel like we care about our health when we don't have it.
Yeah.
It's one of those things. Like we miss it, we try to protect it when it's at risk. But until something happens either to you or a relative, we tend to neglect it and think that we're invincible.
Yeah, it's a very good point. There's a quote I read somewhere, which was, a healthy man wants 1,000 things. A sick man just wants one.
Yeah. You're mentioning cholesterol. There's good cholesterol, there's bad cholesterol. Can you simplify this for me?
Yeah. Let's just talk about the broad concept of high cholesterol. So your total cholesterol is actually a measure of different aspects of the cholesterol, which are triglycerides, good cholesterol, so-called HDL, and so-called bad cholesterol, LDL. Okay, LDL actually makes up the biggest proportion of your total cholesterol. Okay, so for all intents and purposes, total cholesterol is correlated with LDL, so-called bad cholesterol, right? And for decades, the conventional thinking, not just amongst doctors, but it's been such a effective campaign, partly through also marketing of drugs to lower cholesterol, through food industry, okay, low-fat foods, etc. The mindset has been, in most people, is a fear of this high cholesterol because that is the main driver of heart disease and heart attacks. And I can tell you, hand on heart, having spent over a decade, probably 15 years at least, looking at this and studying it in detail and going to depth in the research papers and doing my own analyses and publishing in journals, that I think it is one of the greatest flaws in medical history to put high cholesterol as a major risk factor for heart disease and lowering it to be the solution. I would actually argue that there's a good case to be made that it isn't a risk factor at all for heart disease, certainly in 99% of people. And lowering it is a complete waste of time and actually potentially harmful.
So you're attributing high bad cholesterol to the consumption of sugar, not genetics?
Well, no, it's a good question. So most of your cholesterol, actually, about 80% of the total cholesterol and LDL is genetic. It's produced by your liver. Okay, it actually has many roles. The reason we have cholesterol, it has many roles. It's involved in hormone production. It's important for maintaining the integrity of our cells, the cell membranes. It's a precursor, for example, to vitamin D. But one of the things that's been missed over many, many years, because there's been such an obsession with curbing heart disease, which had increased in the Western world from 1920 up until 1970, before there was a full understanding of how much harm smoking was doing, right? This is, in the 50s and 60s, you'd see adverts on TV where doctors were smoking in their consultation room. And it was like, what brand is your doctor like? Think about it. It's just crazy. Sounds crazy now, right?
Yeah.
Because of that blind spot, there was an over-obsession focus thinking that, there was a few scientists that had certain hypotheses, put some data together, which wasn't robust, and made a case that cholesterol was a major risk factor and therefore all population health policy should be focusing on lowering it. Because of that, people stopped looking at it, going back and looking at the information, which is what I started to do and looking at the research. But one of the things, sorry, just to finish the point I was making, is that high cholesterol actually has an important role in the immune system. And we think it has some protective role. So in 2016, myself and a number of international scientists decided to look at all of the published data in relation to whether or not there is an association with this so-called bad cholesterol LDL and heart disease, like any association, correlation, and heart disease in people over 60. Okay. The reason we looked at people over 60 is that when we went back to the original studies, where the large sort of population studies that were done looking at LDL cholesterol or total cholesterol being a risk factor for heart disease, one thing that was never discussed when you look at the research is that once people hit 50, as their total cholesterol and LDL went down, their death rates increased. And nobody really talked about it because they suddenly thought, okay, we found the risk factor for heart disease here. We need to, get LDL lower. So we thought, okay, let's just look at this again and see in the modern day, what is the association? How much of an association was there? And there was none. First of all, there was no association. And we found an inverse association in people over 60 with LDL cholesterol and what we call all-cause mortality. In other words, statistically, Alberto, the lower your LDL, if you're over 60, the more likely you are to die. So why is that? Two reasons, two hypotheses, if you like. One is, I said, the immune system. Older people are more vulnerable to dying from infections. So maybe the LDL is giving some protection there. Okay. And like, pneumonias and stomach infections, for example. And we know that there is an association with low cholesterol, low total cholesterol and LDL and cancer, which again is likely linked to the immune system. Cancer is partly, in large part, due to immune dysfunction. One of the things that I looked at again during the COVID pandemic, just very briefly, which is something that was not at the forefront of my mind when I started looking at the research. It's like, it's interesting. The people who are more vulnerable to dying from COVID, once you account for very elderly, were people with risk factors for heart disease. And, high blood pressure, for example, 34-fold increased risk of having dying from COVID if you had high blood pressure versus someone who's completely healthy. Obesity, 9-fold increased risk. Heart disease, 18-fold increased risk. Type 2 diabetes, 20-fold increased risk. And when I was looking at that research, it was very interesting. If the same people who had what we call optimal metabolic health, so let's talk about this broad term of these factors I talked about, is metabolic health, actually had much better immune systems. So excess body fat, which is again linked to all of these things, actually makes your immune system dysfunctional.
Excess body fat as in over 15% of body fat, 20%?
Well, I wouldn't say as a percentage. I would say probably looking at it as, in simple terms, probably in very simple terms, BMI. But beyond BMI, I would say the conditions linked to excess body fat. So type 2 pre-diabetes or type 2 diabetes, pre-hypertension, blood pressure slightly going up, this abnormal cholesterol profile, increased belly fat in particular. So very simple rule of thumb, okay, just for people to, is that your waist circumference should be less than half of your height. So let's say you're 180 centimeters tall, your waist circumference at the belly button should be less than 90 centimeters. So that's a nice way of looking at the body fat, just in a very simple way.
So how can I keep a balanced, so what should I be doing on my day-to-day to keep an optimum level of cholesterol?
All I would say is, don't worry about high cholesterol. Worry about triglycerides and HDL, the other components of the profile. You want the triglycerides to be low and the HDL high. And that's it. In very simple terms, the ideal ratio, in mathematical terms, very simple, your triglycerides should be less than your HDL. So let's say your HDL is, we use millimoles in this country, say your HDL is 1.4, your triglycerides should be 1.4 or less. Very simple rule of thumb. That's optimal. And if it's in that range, I really don't worry about what your LDL cholesterol is, total cholesterol.
And when it comes to daily activities, exercise or what should I eat or not eat, to keep these two parameters at optimum levels,
yes.
What should I do?
Great question. So with exercise, interesting. Exercise has, I think, a lot of long-term benefits, even short-term, for physical health. Interestingly, it doesn't have much impact on weight and weight gain. So, we've done, I published this paper in 2015 in the British Journal of Sports Medicine. It caused a huge international controversy. But I published it with two leading sports scientists, and it was actually titled, "It's Time to Bust the Myth of Physical Inactivity and Obesity. You can't outrun a bad diet." Right? So it doesn't mean don't exercise, because I'm obsessed with it, right? I mean, but I do it more for kind of mental and just feeling strong and being mobile and that kind of thing. So with exercise and health and heart disease and longevity, actually, Alberto, very simple. If you're just doing, 30 minutes of a brisk walk every day or 30 minutes of some kind of activity, that's good enough.
And that keeps your heart healthy. Yeah.
Listen, they did an interesting study of ex-Olympic athletes. Elite athletes didn't live any longer than people who played golf or cricket.
But then why do some people that have terrible habits, like they are regular drinkers and smokers, they can live very long, and then you have people that have taken care of their bodies their whole life and they die of a heart disease?
Yeah, I mean, listen, I think this is all about statistics and increasing risk. You're going to get some outliers. I mean, there's a famous...
Is that bad luck or genetics?
It could be a number of things. It's probably genetics to some degree. But there's another aspect to it which comes into the equation, which we don't measure properly or discuss enough, and it's chronic stress and interpersonal relationships. So chronic stress as a risk, it's now been established as a risk factor for heart disease, is the same as being a regular smoker or having type 2 diabetes or having high blood pressure. We're more stressed than ever right now, Alberto, certainly in the modern day.
How would you define stress?
It's very subjective. So, basically, I ask people on a scale when I talk to my patients. I mean, how to define stress is basically your brain, you don't feel that you're able to keep up with the demands that are put on you as a person, whether it's a demand from a spouse, whether it's a demand from work, right?
So it's a perspective of reality
it's
from
a
the
mindset.
brain that affects the body.
Absolutely.
Interesting.
Whether it's a fear that's been exerted on you that you're worried about dying. We see this huge pandemic of fear during COVID. All these things will have and you subjectively feel it. You just don't you feel anxious, right? So I ask people, when I ask my patients, and almost all of them, all my cardiac patients, or people who've developed heart disease or got risk factors, invariably, when I ask them on a scale of 0 to 10, what their levels of stress are, and I just say to them, think of 0 being, imagine a Buddhist monk meditating on a mountain, complete peace and serenity, okay? That being there, and 10 being very high levels of stress. Where are you on that scale? And almost always that, they're above a 7, 8, 9 kind of thing. And they've not done anything about it, not addressing it.
If I'm on that 7, 8, 9, should I go on and seek professional advice?
No, I mean, not necessarily professional advice, but I think you need to think about how do I curb it, right? What can I do? What's causing it? What's the external stressor? Like if you're in a toxic relationship, for example, that's your main stress. You need to get out of that relationship or go for counseling, okay? If it's to do with your job, now, and this is not that easy, and we should talk about this as well. If you're in a job that's causing you stress, can you change your job? Or this is something, again, I'm definitely, I want to talk a little bit more about in terms of advocacy, in terms of what's going on in the population. So there's a guy called Michael Marmot. He's a public health professor, brilliant man, pioneering researcher, who's done a lot of work on something called the social determinants of health. This links to our stress discussion. So I think we should talk about it now. So social determinants of health are estimated actually to be responsible for 35 to 50% of what determines your health, right? Not the medical care. Medical care, by the way, may be 10 to 20%, okay? Determines your overall health outcomes. Most of what determines your health has nothing to do with what happens in the hospital. It happens before the hospital, right? Before you get to the hospital. So the social determinants of health are defined by the conditions in which we are born, grow, live, work, and age, and the causes of those conditions. So if you are, for example, in a low pay, low control, high demand job, Michael Marmot says that can be more damaging to your health than being unemployed. Right? So, and probably through a chronic stress situation.
Have you identified some jobs that actually lead to a particular heart disease or heart diseases in general?
You can look at it, and you can look at it from socioeconomic class. Yeah. So you know that there is a much increased risk of heart disease in people from the lower socioeconomic class, which will correlate often with those jobs. And people, for example, minimum wage, 0 hours contracts, we know those people are going to be at more increased risk of disease. So we've got to ask ourselves, well, hold on a minute. As a society, are we happy with this situation?
Because of stress. Because that leads to stress.
Yes, because of the chronic stress. So what's the mechanism, by the way? This is another interesting aspect of it. So how does chronic stress cause disease? Well, when it comes to heart disease, it causes what we call chronic inflammation in the body. Inflammation is basically a normal response of your immune system to any kind of toxin in the body.
When you're using the word chronic, it means that it's long-term.
Long-term,
okay.
Absolutely. So any response of your immune system, okay, is inflammatory, and an acute inflammation can be life-saving. It stops you, dying from viral or bacterial infections. It stops you bleeding to death if you're cut, okay? But if it's there longer term at a lower degree, chronic, what we call low-grade inflammation, where the immune system's overactivated but not, massively activated, like in a, near-death situation if you're bleeding or whatever, then what happens is the effects of those immune system cells, immune system sort of factors, is they start to damage your own tissues, right? Because they're there to clean up pathogens. So now you've got your own body's producing stuff that ultimately can become toxic to your body and start damaging your cells and the heart arteries. But how does it happen with stress? And the one theory from an evolutionary perspective is that if we were, for example, going back thousands of years, if we're in the jungle and we are running away from a predator, say a tiger, in the acute situation, it makes sense for our body to release factors that are going to be increased clotting factors and immune cells so that we are less likely to bleed to death if we're attacked. So that's what's happening with the brain. It's on hyper alert. But we don't, nowadays, Alberto, we are constantly being bombarded with things that give us stress, even social media, trolling, right? On the other aspect of that, we know that feeling safe and secure is protective for our immune systems and even for our heart. And how does that come, safety and security? A lot of it comes from our interaction with people around us, with our family, our friends, having good relationships, because we feel protected because we're in a group, right? Good quality relationships. So this is also comes back to how the mind influences the body. And then we've got to think about, well, hold on a minute, what's going on in society right now that is taking us away from really optimizing our mental health, what it means to be human. And for me, and looking this in a lot of depth, I think you can associate much, if not most of that, with increasing materialism. So what does materialism mean? It means you put more, your value system is more based upon image, power, status, wealth, than it is on actual things that are good for our brains. Interpersonal relationships, lifelong learning, being engaged in learning new information, growing as a person, right? Being engaged in activities that are not there for some personal gain, even like whether it's reading a book, whether it's playing football or tennis, where you're just in that zone, right? Doing things that are not, for the purpose of their enjoyment, not for any other reason. So this is where the society, I think, is going in the wrong direction, and it's having, a catastrophic effect on our health.
When I think about any problem, in this particular case, the problem is stress, my mind immediately goes into two different roads. Road number one is, how can I prevent it from happening? That's usually my preferred option. And then road number two is, okay, if preventing it is something that is hard for whatever reason, if I end up with that problem, in this case stress, how can I solve it? On the first point, I have two things related to stress or two arguments related to stress that I find it very hard for it to be prevented. Number one is that I believe that we live in a society that is not accommodating someone having stress, because, especially from a professional point of view, if you share with any work colleague that you are suffering from stress, then you might be perceived as weak. And that leads me to the second one. If I right now place you in an environment with a specific type of stimuli, and I place myself, perhaps I might be stressed on that same environment that you might not be stressed, because the way my mind is wired and has been developed is really depending on how I was brought up and so on.
Of course.
So it's really a matter of perspective. And when you share that I'm stressed, a lot of people might dismiss it because that's not stressful for them.
Yeah.
So that leads me to, I think most of us were going to suffer from stress in one way or another, because it's relative.
Yes.
So once we are in that situation, how can I get out of it?
Yeah, really good question. I think if it's looking at making yourself more resilient, then something I do. So, I'm with what I do, and obviously speaking out and being a disruptor, it comes with a lot of external stresses, potentially, my mind. I have to train my brain to try and ignore stuff. So that's one thing I do. But one thing I regularly do, Alberto, is I do breath work every morning. So I do 40 minutes of breath work when I wake up.
And that's preventive, because you do it every morning.
It's helpful. Yeah. It's definitely going to be helpful. To what degree? It's difficult. It depends on how much stress you're receiving, etc. But it's definitely one way that people can, a form of meditation, For me, I find even going to the gym a form of meditation. I do Pilates. So these are things where your mind can then can move away from thoughts that are negative thoughts in relation to whatever you're doing.
Can you share breathing techniques with me?
Yeah, I mean, one thing I do, so I work with this amazing cardiac nurse. Her name's Sherry. She's Spanish origin. And,
of course she is.
Yeah. And she's a cardiac nurse, but she's also a stress reduction expert. And we manage patients together, heart patients together. And she taught me and teaches them a form of breath work. The key really is, and obviously I'm not the expert, I'm someone that, she's taught me to do it, but basically it's about diaphragmatic breathing. So when you breathe in, a lot of people breathe up here in the chest, but actually you want the breath to go much deeper into the diaphragm, and that has a better activation of what we call the parasympathetic nervous system that is going to slow your heart rate down, lower your blood pressure, for example, right? And obviously release good hormones into the body. So I have this technique where what I do is I breathe in through my nose for 4 seconds, I hold it for 7, and then breathe out through the mouth for 8. And that kind of pattern is something that helps stimulate and slow the heart rate down. And interestingly, it can be really, you can see massive differences in people's blood pressure. People who've got high blood pressure, a lot because hasn't been, sort of detected because of, as in the cause hasn't been detected, which is related to stress. When you do this sort of meditation thing for even 5-10 minutes, their blood pressure can drop massively into a normal range, so it's something definitely people need to think more about.
So what you want to do is to reduce your heart rate.
Yeah.
That's the main target.
Yeah, I wouldn't necessarily, naturally the heart rate will go down to different degrees, blood pressure will go down, but I wouldn't think about those parameters. That happens as a side effect. I would just do the breathing because it will calm your mind. And I do it regularly, and you notice, Alberto, when you start doing it, you get out of bed in the morning, you're just like, I feel so much calmer to start the day, And also one of the other things I do is I deliberately refuse to look at any screens in terms of my phone or whatever else for at least, I'm doing the meditation obviously in the morning anyway, but I would say at least 30 minutes after waking up, because we think, and I think that our addiction to, obviously through the algorithms and the engagement, our addictions to screens and social media is not good for the brain. That's something that needs to be explored in terms of what's the limit. How do we then do the research to figure out, is there a limit? For example, do we need to give guidelines out saying that we know now that any more than 30 minutes of engagement with a social media a day or screen is actually having a negative effect? I don't know the answer. I'm just saying, for example, we need to explore that because we know it's having a damaging effect for lots of different reasons.
I feel like when someone is suffering in today's day and age of any problem, in this case stress, when they go and see their doctors, probably one of their first recommendations is to prescribe them a medicine.
Yeah.
But it wouldn't be, I don't think I've ever been to any doctor that gave me a set of instructions on how to change my life and then would tell me, try this for 2 weeks and then come back and then we'll try something else. I think in most cases, I always got out of the room with a sort of prescription.
Yeah.
And the team told me that through the research that we went together, that overprescription is today the 3rd most common cause of death.
Yeah.
Is that right?
Yeah. So prescribed medications because of side effects are estimated to be the 3rd most common cause of death globally. Why is that? Because the safety and benefits of medications prescribed by doctors is grossly exaggerated by drug companies who control the data, but most doctors don't know that. So doctors may be well-intentioned thinking that the information they're getting on certain drugs from guideline bodies is rigorous and independent, when in fact it's not at all. This is what they've done over time through this neoliberal economic model, where they've got more and more power, where big corporations like Big Pharma, Big Food went from, certainly up until maybe 1970, having a business model that was geared to addressing and supporting many different stakeholders, the consumer, the community, shareholders, right? And now it's just about shareholders, and they forgot about the community. And that's partly because of this guy called Milton Friedman, who you may know. He was Nobel Prize-winning economist that influenced Ronald Reagan and basically is responsible in many ways, the brainchild behind the current economic model, is that we reduce all these regulations on these big corporations. And I'm sure it was well-intentioned. But as a result, we've now got this situation where corporations, I think people need to understand this, their only legal obligation is to produce profit for shareholders. But the diagnosis of the entity that is the corporation has been given by the forensic psychologist Robert Hare, supported by law professor Joel Buchanan's book, The Corporation, as an entity to understand what we're dealing with at the root, because I'm a root cause guy, Alberto. I think you know what I'm going to say. That diagnosis is psychopathic. So when the guy behind the original definition of psychopath, by the way, has labeled big corporations psychopathic. So some of the characteristics of psychopath is callous unconcern for the safety of others, incapacity to experience guilt, repeated lying and conning others for profit. And there's another definition that's come in the last few years, and the new corporation, but as psychopath, is also using excessive charm to persuade people, to do something of interest to that person or to the corporation. So the current paradigm, if you like, and I can liken it to what's happened, for example, with the COVID vaccine, is that these big companies are putting them forward as being, we really care about the public and we're doing this, whatever else, and using charm or whatever else. That's actually part of the diagnosis of psychopath. So, yeah.
But if some or most doctors are unaware of this,
yes,
then definitely the patient is totally unaware of it.
Absolutely.
What should we do? What should the average patient do? Should I challenge my doctor's prescription?
Well, first of all, they should listen to this podcast.
That's for sure.
Yeah. They have to ask questions. Listen, an interaction between doctor and patient should be on an equal level, in the sense that our duty as doctors is to help the patient, right? We're doing a service. That's what we're there to do. So therefore, the most important person in the room is not the doctor, it's the patient. So they should ask questions, absolutely.
If I extrapolate this example into a car issue, if I bring my car to the mechanic and then the mechanic is telling me your car has a problem with the left valve from the engine that is not pumping, whatever, my answer is going to be, great, let's fix it.
Yeah.
But I'm not going to challenge that because I'm not equipped to challenge it. So unless I go to another mechanic or I go to another doctor, it's going to be very hard for me to have these conversations with the professional.
Yeah, you're right. That's a fair point. And that's why, certainly something I've worked on, and we need to change the culture within the profession. We need to educate the doctors better, certainly in terms of being more skeptical about drug trials. But of course, on a policy level, we need to make sure the data is independently verified. That doesn't happen. So that's something that can happen at the top end. For a patient, again, I think if they are privy to information like this that we've been discussing, they should just have that conversation with their doctor and see what happens. I mean, what else can they do? They just have to try and take information from many different sources. But patients still, interestingly, Alberto, a lot of patients come to me who've decided that they don't agree with their doctor's plan. For example, taking cholesterol-lowering drug because they've heard me speak or read a book. And they'll come to me and say, listen, I decided I didn't want to do that. And ultimately, even when I have conversation with patients, it's about informed consent, and actually telling patients, for example, if you take this pill, there's a 1% benefit. Again, this is something else that doesn't happen in normal practice. Based upon interpretation of biased research already, there's only a 1% benefit of taking a statin over a 5-year period, for example, in preventing heart attacks and strokes. There's a huge knowledge gap here, Alberto. But yeah, what can a patient do other than trying to ask questions, learn as much as they can, and then have that conversation with the patient, with the doctor. The doctor may learn something new too. I learn stuff from my patients all the time. A certain supplement they've taken that's helped them with certain things. I say, oh, that's really interesting. Tell me about that, I'm curious. A good doctor should be there also wanting to learn from their patient, not just tell them what to do.
Segmenting this into the 4 different stakeholders in this equation. So you have a stakeholder number 1, which are the pharmaceutical companies. I don't really think the change is going to come from that end. But perhaps on the second stakeholder, which is from policies, from the government.
Yes.
Then the third stakeholder are the doctors, the medical institutions.
Yes.
I fundamentally think that if they are better trained, better educated to challenge the way that you're challenging certain aspects of the industry, that's going to then benefit definitely the patient. But going back then to the patient, which is where I include myself, are there any organs in our body that if we are prescribed medicine, we should definitely ask for a second opinion or challenge it? So perhaps if my leg hurts and they prescribe me whatever, okay, the worst case scenario of that medicine is not too bad. But if perhaps it's something for the brain or for the heart, then I should definitely challenge the prescription.
Listen, the one thing that I've got expertise on is statins. They're massively overprescribed. This is one of the most prescribed drugs in the world, estimated to be prescribed between 200 million and 1 billion people. Okay, most of those people are not going to get any benefit at all, and they're not told that. And they come with side effects that can affect the brain in terms of memory. They can affect, cause muscle pain, fatigue, erectile dysfunction, stomach upset. And often they're not picked up. People go for investigations for other things when the whole time it was a statin causing the side effects. So that's definitely one. Absolutely. Massively overprescribed.
What about AI tools? Are they useful in any way?
Yeah. So, I was having a conversation with with somebody yesterday about this. I'm very skeptical about the use of AI. Okay.
For the patient.
No, for the patient, I think there's the AI tools, for example, for making a diagnosis, I don't think are going to be very helpful. They're going to increase extra work and anxiety. There's an art to medicine as well through that conversation of trying to figure out what's wrong with the patient. Also, the patient comes to a doctor obviously from a place of fear. And we know from research there are two important aspects to a successful patient outcome: the history, the conversation to make the diagnosis, all right? And the other one, which is equally important, is empathy. Patient wants to feel that the doctor cares for them. Is an AI tool going to give you empathy? Come on, man. It's complete nonsense. I think what's happened is there are people who've got this technological mindset, and I think there's amazing advances we've done in technology. You can't apply it to medicine. Medicine, again, there's another myth that needs to be busted here. Medicine is not an exact science. It's not like physics or chemistry or even engineering, all right? It's a social science of human beings, constantly evolving, right? And I don't think an AI, listen, there may be some specific, very limited role it has, fine. But to use this as a new approach I think it's going to be a lot of waste with not much benefit.
Okay, so this is the patient being in the consultation room and getting a prescription. Now let's try to avoid that. So let's go back in time or reverse engineer it. So we don't want to land into that consultation room. Diets. There's so many diets out there. I personally have tried a lot of them. And if there's one thing in common in between all these diets is that they all claim to be the ultimate diet that is going to change your life for the better or the best and so on. You've developed a diet called the Pioppi diet?
Yeah.
What is it?
So I don't think one diet fits all. I think on a basic level, the one problem right now with our diets and populations is that we're consuming a lot of these ultra-processed foods. So foods that aren't going to nourish you, are going to lack fiber, and are going to increase insulin resistance, which we talked about as the main driver of heart disease and probably one of the main drivers of cancer. So you want to eliminate or minimize at least those foods, these so-called ultra-processed foods. Very simple. And these are foods that have at least 5 or more ingredients, packaged, usually the additives and preservatives. Lots of research showing that they're linked to many, many diseases now. The next question is, okay, what is the optimum diet? Well, any diet that's going to nourish you, give you all the nutrients and micronutrients you need, which is going to be from whole foods. For me personally, from a heart disease perspective, I looked at all the research, like what is and I devised this in an original way. What is likely going to be the best diet from a heart disease perspective, maybe from a cancer perspective? And the one that I, obviously put together is based upon the traditional Mediterranean diet, but without the bread and the pasta and all that stuff, right?
Okay.
Partly because...
None whatsoever.
Well, it depends where you're starting from, Alberto. Most people in this country and in the US have markers of abnormal metabolic health, insulin resistance already. The best way to combat insulin resistance, or the most effective way, is to cut out the carbohydrates.
Completely.
The starch carbohydrates. Well, yeah. To get a baseline, to get back to normal metabolic health, yes. And then you can then add back in, and I say then follow the 80-20 rule. 80% of the time, follow a low-carb diet. 20% of the time, if you want to have a pizza on the weekend or a chicken biryani, who cares, right? That's kind of what I do.
But from a pizza to a potato, there's a big gap. So are potatoes or brown rice on a daily basis bad?
Starch. If you already have metabolic health markers that are abnormal, or you have an increased waist circumference, overweight, for example, then those foods are not going to help you get to an optimal level of metabolic health. So what I suggest, and this is a program that I've just started, I did a pilot, which was very successful. We had people reversing their type 2 diabetes in 4 weeks, which I've been doing with my patients for years, is what we suggest, it's called Metabolic Reset, is that people, at least for 4 weeks, even up to 3 months, but I would say with my patients, varies from person to person, 6 weeks, go completely cold turkey on sugar and starch. Cold turkey, to get you to a baseline of what you could be. And then you can, a lot of people then, the thing that's interesting, Alberto, is they feel better, they sleep better, they have better mental clarity, better energy levels.
This includes fruits?
Low sugar fruits are better. And in the initial stage, you avoid the high sugar fruits like bananas.
So in this 6-week period
yes.
of
So berries are fine. Blueberries, blackberries, strawberries, for example, raspberries, they're fine. Those are the low sugar fruits. You can have maybe an apple or whatever else, a pear, which is kind of, I think, moderate, sugar fruit, initially, for 6 weeks, without any bread, pasta, rice. Brown rice is no much better than white rice, by the way. Okay. So for example, white rice has 2 grams of fiber per 100 grams. Brown rice has 3. I mean, it's a whole myth nonsense about brown rice being better for you. It's just complete, pardon my language.
You just broke
bullshit.
my tie.
Complete bullshit, right? Okay. So if you're going to have rice, just have the white rice. Okay. No point having brown rice. But yeah, I know, man. Tell me about it. It's crazy. Same kind of goes for brown bread as well. Because we know that it increases blood glucose to a similar degree. Is very little extra fiber.
Even seeded bread with lots of seeds and some because you have fats.
Yeah, it depends on the fiber content. So a good rule of thumb is you want to have a ratio of at least 1 gram of fiber to every 5 grams of total carbohydrate.
Okay.
So let's say a product has 20 grams of carbohydrate. You want to have at least 4 grams of fiber in there. That's a good rule of thumb. But the other issue comes in as long as it's not an ultra processed food. So all ultra processed foods should be out of the equation too for this period. Now, this isn't forever. We like treats. Okay, what's happened is we've become hooked to treats because food industry have designed these food products with sugar and all these other things to basically get us eating more and more and more. That's how they make money. Big Tobacco did something similar with their cigarettes. They refused to even accept for many years, probably deliberately, that they were addictive. In fact, 1994, the CEOs of every major tobacco firm went in front of US Congress and swore under oath they did not believe that nicotine was addictive and smoking caused lung cancer.
Probably with a cigarette in their hand.
Yeah, right. So, I mean, this is just the willful blindness or whatever it is, the psychology or whatever it is. Their primary purpose is to make money. So, the food industry are the same. So, we just have to think, hold on a minute. Am I happy that I'm being manipulated? Right? This is not about free will. You're being manipulated and exploited to eat certain foods. I'm not talking about the foods that people know are junk foods, like your fast food or whatever else. I'm talking about food that's even marketed as healthy or low fat, whatever else in the supermarket.
Can you give me an example of a food that is marketed as healthy and it isn't?
Well, for a long time, I think it's getting better. Certainly, low fat foods proven to lower cholesterol, being full of sugar and that kind of thing. These are the kind of foods.
The diet you're describing sounds very similar to the keto diet.
It can be keto. Absolutely. It can be keto, but Mediterranean. So why I call it Mediterranean is there are, from research that we've got in nutrition science, which has limitations. It's not the most robust science, but we have to look at best evidence that we have. So certain aspects of the Mediterranean diet are likely to be beneficial, anti-inflammatory, extra virgin olive oil, for example, nuts and seeds, whole fruit and vegetables, low sugar fruits, lots of non-starchy vegetables, high fiber vegetables. These are the types of oily fish, omega-3 fats are really important for the brain and for the heart. Oily fish a couple of times a week. So as long as people have got those in their base of their diet, they've cut out the ultra-processed foods and minimized the low-quality carbohydrates, the rest of it doesn't matter. If they want to have a steak, no problem. Steak doesn't cause heart disease, doesn't cause colon cancer, okay? Unprocessed red meat is not an issue. cheese, full-fat cheese, for example, may be protective. There's some studies suggesting an association. It's not rigorous data, but may be protective against heart disease. So, and it's enjoyable. At the end of the day, listen, food is one of our greatest pleasures. It's certainly for me. I'm a big foodie. I cook almost every day. One of my greatest pleasures in life is food. Mm-hmm. And I follow this diet and I love it. You know, you can make it tasty. I'm lucky and maybe a bit biased because I've Indian roots. Mm-hmm. A lot of the food I cook is Indian, and Indian food is just, you know, there's so much variety, and certainly with vegetables. So you can enjoy this, yeah? You can totally enjoy this diet. It doesn't have to be restrictive and make you feel miserable, but you have to break the addiction first. Once you break the addiction, then your palate changes, especially to sugar, right? And then as someone who's a reformed sugar addict, I don't crave sugar anymore.
How long does it take for
3 weeks?
3 weeks.
3 weeks. It can take 3 to 6 weeks, even less.
That's any addiction.
Well, certainly with the food stuff, yeah. For most people, you can break that addiction within 3 to 6 weeks. But one of the challenges as well, just to mention this for people, is we're still having to fight against this food environment, which is saturated with all these foods, right? Smells and, you know, whatever else. And also the chronic stress. If you don't deal with the stress, we tend to reach for these sorts of comfort foods when we're stressed, right? So addressing the stress at the same time makes it more likely you're going to sustain it.
So in your diet, you've mentioned low carbs to no carbs, zero sugar, fat, proteins, whole foods, nothing that has more than like 1 or 2 ingredients, so effectively just whole foods. It sounds, in a way, not too complicated to follow.
No, it isn't. And there's a lot of variety there, Alberto. People think, you know, I got a bit of trolling on social media from other doctors when I, you know, called out the fact that during the pandemic, one of the teaching hospitals in London was bragging about the fact that Krispy Kreme donuts had given 1,000 free donuts to the staff or something. I was like, this isn't really setting a good example. First of all, junk food shouldn't be sold in hospitals. 70% of the food purchased in hospitals is ultra-processed, which is not good for healing, doesn't send a good message out there. And, people were basically trolling me saying, oh, yes, you know, you expect us just to eat salad or something. I was like, no, you can eat so many other foods that are not just salad that are really nice and tasty and enjoyable, right? So I think people have this concept that these sorts of diets are so restrictive and they're boring and they're bland and I'm going to feel miserable. No. If you get through the first 3 weeks, you know, it is a bit of a challenge initially for me, you know, having to change my diet. I mean, I was total sugar addict, man. Sugared cereal for breakfast. I then thought it was normal for me to feel hungry at 10:30, and I'd usually have a chocolate bar, okay, packet of crisps and a chocolate bar. Comes lunchtime, I'm working in the hospital and I'm going to Cafe Nero and getting a grilled panini, right? And because I'm always so hungry, I'm getting grilled panini and I'm getting pasta. I was a glutton, right? And eating pasta. And then about 2:00, after lunch, I'm suddenly feeling sleepy like this. I was like, obviously because of the carb crash. I then go back to Cafe Nero and I get a mocha. And by the way, this is my routine. I'm telling you my routine for years, right? I then go and get a mocha coffee to wake me up. And I would insist to the barista, please put extra squirts of chocolate in there. And then I'd go home and I'd cook my dinner and I'd have whatever, chicken and rice, okay? Then I'd feel hungry about 2 hours later, even if I had pasta. And then I'd have some cake before I went to bed. I mean, this was me for up until the age of certainly probably 30. This is normal for me.
But I have some friends that they follow a very similar lifestyle, but what they tell to themselves, but also they share it with me, is that, well, I'm eating sugars, I'm eating starches, but I'm balancing that out by going regularly to the gym.
Yeah. So this is why I wrote the article in Virtual Sports Medicine. What we found is very interesting. You can be normal weight, exercising regularly, but if you're consuming too much sugar, which a lot of these people are, still massively increasing your risk of type 2 diabetes. This is a myth. You can't outrun a bad diet. You can stay slim, but this is another issue as well. We talked about excess body fat. About a third of people who develop these metabolic health problems are going to massively increase their risk. Their body mass index is normal. Right? And even if you've got guys with 6-packs who are consuming too much sugar, I've managed patients who have had heart attacks in their 40s, they've got 6-packs. And you go through their diet and it's terrible, and the stress. So it's not just about the weight. And we know that research shows sugar is harmful to the heart independent of weight, just like cigarettes is.
For example, my girlfriend, she's fit. slim because she exercises regularly. She has a balanced diet, but every day she eats 1 or 2 pralines because she loves chocolate, sweet chocolate. Is that going to have very bad consequences for her heart?
It depends. Okay, so you can calculate it. Is it the praline? Is it just a chocolate covered nut? Then is it?
Yes. Imagine like a Lind sort of.
Okay, let's try and give some definitions so people can understand what's. So, the World Health Organization, and they did this in partly because of the campaign that I was heavily involved in and kind of started in this country. You know, Action on Sugar was this organization that I was a science director for and founding member for. Ultimately influenced the sugary drinks tax in this country. The WHO ultimately looked at the research independently and concluded that the maximum consumption daily of teaspoons of sugar, after which there is an increased risk on average in people of developing all sorts of conditions, was 6 teaspoons a day. So 4 grams is 1 teaspoon. So and this is what we call free sugars. So this means any added sugar in the food, right? In chocolate, for example, includes fruit juice, honey, and syrups as well. So if it's more than 6 teaspoons in total, then you're probably increasing your risk. So
to me, 6 spoons sounds like a lot.
Yeah. Well, I mean, listen, when I went through my diet and I look back at what I was eating, with all the different foods, a chocolate bar and whatever else, sugared cereal, I was getting through about 40 teaspoons of sugar a day. And the average Brit is probably still getting close to 20 teaspoons of sugar a day in all the foods that they won't even realize has got added sugar in it. So you can look at the label and count the number of grams and figure it out.
And the effects on your heart is that you're going to increase your bad cholesterol levels, your blood pressure is going to...
Triglycerides, blood pressure, these are the things over time. Obviously, it's going to vary from person to person, but slowly over time, it's increasing these problems, insulin resistance for sure.
Fasting. There are so many different types of fasting. I think we've been talking about them for so many years now.
Yeah. What
are the different types that you would consider useful?
Yeah. Again, there's a lot of mixed information in the research and also anecdotally about fasting. So for me, some people do this, what we call 16-hour fast, where they'll just eat within an 8-hour window. Listen, if it works for you and you feel well, then great, okay? As in you're able to eat in that 8-hour window, you feel that you're keeping yourself in check, your food that you're eating are nutritious. Some people, they love it. When I started doing it, for example, I struggled a little bit because I tend to work out in the morning. And when I work out fasted, it ramped up my stress hormones. And it didn't suit me at all. I felt crap. Really low energy, awful. So I have to eat before I work out. So it depends on person to person. If you've got a lot of stress right now in your life, fasting can make the stress worse. So I would generally, my default still, Alberto, is just eat 2 to 3 meals a day, eat when you're hungry. As long as you're eating nutritious food, eat till you're hungry, stop when you're full. However, having said that, some interesting research has been published last year. One of the top, if not the world-leading researcher on fasting is a guy called Walter Longo. He's an Italian-American based in California. And he developed this, something called the fasting mimicking diet. What he found, first of all, in animal studies, is that if you were to fast, just do a water fast for 3 days, it would affect genes that control aging, okay, and slow the aging process down. But he felt, I think, from what I understand, I hope I'm not misquoting him, is that the 3-day water fast, so imagine just having nothing but water for 3 days, was going to be quite challenging for most people. So he developed a diet plan which would be easier for people to follow, called the fasting mimicking diet, which was basically going to have the same effect as a 3-day water fast. And by the way, I've tried this. I mean, I've done it. I've done it like 3 times. So what he suggests is that for 5 days, only for 5 days, for 3 consecutive months, so once a month for 3 months, okay, you consume no more than 800 calories of something that is essentially keto without animal protein. So it's just vegetables, maybe some low sugar fruits, where you are essentially, in ketogenesis, which basically means your total carbohydrate consumption is less than 50 grams of carbohydrate in the day, okay? And you do this 800 calories a day max for 5 days. And only last year they published very interesting studies where they took lots of middle-aged people I think in between 40 and 60. And they did this plan for 3 months, and then they did a test looking at biological aging. And on average, they were able to reduce their biological age by 2.5 years just by doing this 3 times. So imagine this fasting, it suggests this is going to slow down your age. So let's say you're 50 years old and you do this thing, and they have a marker of, biological age that makes you 50. And then you do this fasting program just 3 times for 5 days, okay? And then it comes back, your test says you're now 47.5. Pretty interesting. So that's the best data I've seen, which I think is fascinating. Yeah. So at least there's some evidence behind that now. And my suggestion to patients would be, if you can do the fast, then why don't you try this plan? It's pretty safe. I think the only thing I would say is someone who's very active. During that week, I didn't go to the gym. I'll go for a bit of a walk, just a nice, gentle walk, but no intense exercise when you're doing that. Because again, that's going to probably ramp up your stress hormones.
There's just one thing that I have a slightly different opinion to what you were mentioning.
Oh, sorry, one quick thing, Alberto. Yeah. So the mechanism is why it's effective is you're reducing insulin. We talked about insulin resistance. And there's another mechanism through animal protein that by eliminating animal protein, I think it's called mTOR. It's some kind of, I think, hormone that induces what we call autophagy, which means that the cell is more likely to regenerate, etc. So this is the proposed mechanism behind this. Mm-hmm. But yes, go on.
Intermittent fasting, it's not for everyone. You should do whatever works for you. And I completely agree with that. In fact, I follow the intermittent fasting, the 16 hours of not eating anything and then 8 hours of eating. I eat 3 times a day, and that works for me. I feel energized. I feel also... At the same time, I feel strong, but I feel light. I feel very mobile. I feel that I don't get brain fog. So it does work for me.
Yeah.
But you've said that we should eat 3 times a day. And when we eat, we should eat until we feel full. I have a slight discomfort with that because I don't trust myself when it comes to knowing when is it that I am full. Yeah. For example, we've recently interviewed an amazing sleeping neurologist expert. And one of the things that he was sharing with us is that if you're sleeping less than 6 hours on a given night, the day after, you're prone to consume 40% more calories. So that is one, let's say, indication that not every day our appetite is going to be at the same level. Yeah. I'm pretty sure that there might be other reasons that are not related to sleep. So because of that, I try to measure in a way what I am putting on my plate. Maybe not scaling it, but like, okay, maybe 2 pieces of chicken, not 3.
Yeah.
And do you think that's wrong?
No, that's fine. I mean, it works for you. It's interesting. I didn't know about the 40% thing. The only thing I would say, Alberto, is nobody was discussing obesity up until 1980. Now, we've been on this earth for how long? I don't know, tens of thousands of years, something changed in the food environment that got us to increase our appetite. So I say this eat till you're full is that if you're eating whole foods, essentially, you shouldn't. In Japan, they have this cultural thing that you eat till you're 80% full, apparently. So you feel 80% quite full. So you're not, you've got rid of that real hunger, but you can still eat a bit more, but you stop, right? That works for them. So, whatever works for you. I don't think there's any issue with that. If you feel that helps you. I think, it's interesting though.
What about water? Yeah. Is there a link in between how much water we need to consume every day and our heart health?
Not directly, no. I think, again, if you don't drink enough water, obviously dehydration will increase stress hormones, which, again, isn't going to be good for your heart. So, but we evolved to drink when we're thirsty. We should listen to our bodies.
You kept mentioning the Mediterranean diet. In Spain, which is part of the Mediterranean, it's considered a Mediterranean diet.
Yeah.
It is believed that if you drink a glass of red wine a day, just one, it's going to be good for your heart.
Yeah.
Is that the myth?
There's a lot of controversy about alcohol at the moment and heart health. The person I spoke to actually is the world leading, when I educate myself on this, is a world leading researcher on wine called Roger Corder, Queen Mary University. Okay. And he has a lab where he analyzes different wines to look at something called procyanidin. It's an anti-inflammatory compound in the wine. which he feels is linked to reduced disease. Not all wines are the same. And in his book, I'm not here to plug it, but I can tell you, I mean, it's called The Wine Diet. He talks about it. It's very interesting. Certain wines have more, these anti-inflammatory polyphenols or whatever. My personal view is I think that actually there probably is, in moderate consumption, some benefits of certain red wines for sure. But in the Mediterranean regions, it was with food, I think there's something about maybe the British culture where the binge drinking and all that kind of stuff. I don't think that's pretty helpful. I think when you look at the traditional Mediterranean diet and the way people ate, sitting at the table with company, with food, not usually an empty stomach. So I think that, if you put that all together, there may be some synergistic positive effect, yeah. But listen, I have a massive bias, I have to declare. I love red wine.
So
I would like to think that red wine is healthy. So that is my bias.
Let's go back to exercise. So if we've mentioned that exercising regularly 3 times a week is healthy for the heart. And I think almost everyone knows that's general knowledge. Like exercising is good for you for so many different reasons.
Yes.
But I exercise probably a lot, and I would like to know how that looks like. Is it like 5 days too much, 6 days? So how does over-exercising look like, and what are the consequences to the heart?
Yeah, I've had some patients who've done everything. They're slim, diet's good. I remember one particular lady I saw last year, and she was in her 50s, and she was, she had something called a calcium score that was very high. Calcium score is a test you can do. It's nothing to do with dietary calcium, that shows how much inflammation and buildup of blockages within the arteries is in the heart. And it was extremely high, over 1,000. And, she didn't have any symptoms, but she was a bit shocked by it. And I just went through her, discussed like her lifestyle. Okay, so let's talk about, exercise, sleep, stress. Stress was a bit high, definitely, not crazy, but was only getting 4 hours sleep a night for a long time, but was running 10 miles a day. And I was like, okay, and interestingly, there's some data showing that, I remember reading this from another well-known sports cardiologist in London in a letter I got, through a patient, where it was something like 11% of elite athletes will have significant furring of the coronary arteries by the time they hit 50. I think it's a stress issue. So too much exercise basically is going to increase stress hormones.
What would you say is too much exercise? Okay,
great question. So if you look at I would say more than 10 hours of a week of aerobic exercise.
Aerobic.
Yeah. Especially high intensity.
Okay.
So for example, with my patients, I tell them, there's a whole craze about HIIT, high intensity interval training. Mm-hmm. I generally recommend that people shouldn't really do high intensity interval training more than once a week. If you've got, it's all relative. If you're sleeping great, you're getting at least 7 hours sleep a night, really sleeping great. If your stress levels are low, you can probably get away with a bit more. If you're not sleeping that well, and you've got high stress levels, high intensity training regularly is going to be bad for your heart. So for me personally, and I'm obsessed, like I want to optimize myself. I go to the gym every day. I've been, I used to play a lot of sports competitively, etc. So I'm very much in, I know a lot of sports scientists. I tend to keep my, I keep within a heart rate, which is what we call, 50 to 70% of your maximum heart rate, 30 minutes, 5 times a week. I think that's zone 2, I think you call it, right? So I would just keep, regular moderate exercise is fine. It's when you really, go high intensity. The other interesting thing about exercising the immune system is that if you look at, marathon runners, for example, they develop 4 times more respiratory infections per year than somebody who is just doing moderate exercise, and doubled somebody who's completely sedentary. So exercise, probably through a stress response, is overdoing the exercise. So like, for example, running more than an hour a day, that's going to cause a depression in your immune system. And that's going to make you more vulnerable to infection.
Interesting.
Yeah.
So we're trying to keep our stress levels down by...
Basically, too much exercise is bad for your health.
Okay. So we're trying to keep the stress levels down by following a diet that is low in sugar, low in starches, exercising regularly, but not over-exercising, so not more than 10 hours a week.
I would say ideally probably kept to about 5 hours a week.
Then it just
Max.
came to mind that what about socializing? Is that a good thing to keep our stress levels down? Is that
Absolutely.
so? It's good for the heart.
Proper interaction. I'm not talking about, socializing through social media. It's a fake form of connection.
So if I'm going out for dinner, I'm doing something good for my heart.
Yeah, if you're laughing, you're spending time with friends, and I think that's good. Absolutely, for sure. I also think physical touch, I think, has a big role to play as well. I actually prescribe hugging to my patients.
Hugging.
Certainly to the couples, or where one of them's maybe suffered a heart issue or whatever else, is there is definitely some impact of hugging on stress hormones, and yeah, I think that's something again people should think a little bit more about, because during the pandemic as well, we were told not to keep our social distancing, all that kind of stuff, physical distancing. Very bad for the mind. Not what us humans, not good for us humans. We feel safe and protected if we are, with people we love and care about, It's and if you look at other research, interestingly, one of the most important factors for longevity is having someone that we love and someone that loves and cares for us. That is actually maybe the secret, one of the most important secrets to lifespan. You look at blue zones, these so-called areas around the world with high longevity. None of these people were in a gym, pounding it in the gym, man, living to 100. They just had a very strong sense of community. Pioppi, this Italian village where my book, the Pioppi diet, is the home of the Mediterranean diet, is not an affluent place. It's a fishing village, southern Italy, close to Naples, the province of Salerno. And these people were quite poor in relative terms, right? But they really looked after each other. They really cared for each other. And they had, average life expectancy is above 90.
And your assumption is that if we care for each other, we're bringing our stress levels.
Yes, and that's
down.
protective because it makes us feel safe.
What about sex? Is there a correlation in between having regular sex and our heart health?
There's some observational study that showed that men in the middle age who had sex twice a week were 50% less likely to develop heart disease compared to men that had sex once a month. Now, I'm not encouraging people to be promiscuous here. I think it was done in the context of a stable, loving relationship. So it may be a confounding factor. And of course, if you're in a relationship and you're having sex once a month, it may be a problem. It may reflect that the relationship isn't good.
It just came to mind that perhaps the sex industry, I don't know, the condom industry, perhaps Durex can start funding researches for medical institutions, just like the pharmaceutical industry is doing it. So then doctors can prescribe having sex and giving you condoms.
It's a fascinating question. I don't know if anyone's done even a survey, an observational study where they've calculated, the frequency of sex over a period. I mean, it's an interesting study to look into. I'm sure if someone should do that. Is there a correlation with frequency of sex and reduction in disease?
I'd like to think there is.
Yeah.
The more sex,
and I think, my guess is though, it's going to be almost certainly positive with a stable partner, and it may be negative if it's multiple partners. If you're a single guy or single girl, it may be negative because if you think about that kind of pattern of behavior, that isn't really a deep connection. That's actually almost like a way of maybe an addiction or a dopamine hit that people are getting to fill a void of loneliness. I'm just thinking aloud here, Alberto.
We've talked about the case in which pharmaceutical companies, the pharmaceutical industry, is subsidizing researches or subsidizing entire medical institutions. And I'd like to know what are the consequences that a normal patient can have because of that.
First and foremost, because they are controlling the data and they are primarily only motivated by making money, we're not getting clean information on drugs when patients are prescribed them. So there's no real informed consent going on about risks and benefits of drugs. And most doctors don't know this, Alberto. That's the big issue, right? The reason that, there's somebody I call the Stephen Hawking of medicine in America called John Ioannidis, professor of medicine at Stanford, professor of statistics, brilliant mind, most cited medical researcher in the world. He wrote a paper in 2017, and people listening can look this up because you can read it. It's open access. It's brilliant. It's called How to Survive the Medical Misinformation Mess. And he makes a point that most doctors are unaware of the poor quality research that drives overuse of medications, underuse of simpler, safer options, waste, avoidable harm from side effects, and missed opportunities to give the right patient the right treatment at the right time. And as a result of that, and this is extraordinary, let's come back to the economic issue and market failure, 20 to 50% of all healthcare activity in the United States brings no benefit to the patient, is wasteful or harmful. Right? And they spend over $4 trillion on healthcare. And as a result, this is, and he said it is rooted in the fact that the research is biased and corrupted and poor quality. But he said the reason the problem that this situation hasn't been resolved is most doctors don't know that. And the reason most doctors don't know that is because it's not being discussed in mainstream media, right? And a lot of the mainstream legacy media is great. Obviously, we have alternative media now, which is getting much more attention. And I even think helped win, Donald Trump win the election with the help of Robert Kennedy Jr., my friend, is the legacy media is bought and paid for by the very industries that are profiting from basically lying to you, from deception. So the way we overcome this, of course, is through knowledge and spreading the information and people understanding the truth, and that can happen, through a ripple effect. But it's still the dominant, narrative. So, for example, I'm sure even after this podcast, you'll get a lot of people who, of course, I believe in the power of speech to change people's minds, right? And I think people can genuinely, there's something within human beings that allows us for truth to resonate within our hearts. And I hope through this conversation that's going to happen. But for other people, for example, let's say someone's watching this podcast. This is what's going to happen. I'm going to predict this because it's happened with before. There's somebody who's going to watch it and they're going to think, oh my God, this is amazing. This information is so important. And they're going to maybe share it with their nurse at a hospital or someone they know that is maybe taking lots of medications. There will be an immediate, natural, initial psychological barrier to trying to accept a different paradigm or change someone's worldview where they think that they completely should trust their doctor. By the way, the doctor's well-intentioned. I'm not saying the doctor's being malicious here. The doctor doesn't know this. And the first thought would be, the called psychological barrier to the truth, is to try and, in your mind, create reasons why this guy, me, can't be trusted, right? How can everybody else say the opposite of Dr. Malhotra? How can this be wrong? Maybe he's doing this for fame or personal gain. Maybe he's mad. These sorts of things, you see it all. So, and that's because, again, partly there's a reinforcement through the mainstream media as well of the message. And what's happened historically when you've got truth seekers and people who have the, who are not afraid to speak out, is there is always, a coordinated attempt from those very industries to smear those people. And that's happened historically in many different situations. And one of my inspirations is, it keeps me going, is Mahatma Gandhi, who said, first they ignore you, then they laugh at you, then they fight you, then you win. So when I'm getting attacked, then I see that as
he went through jail during that process.
Absolutely. Mandela, for example, says that his greatest inspiration in jail was Gandhi, right? So there are points in history where certain people are, made to be the bad guy through the mainstream
You're
media.
calling out some of the biggest major players on planet Earth.
Yeah, but and
one of the biggest industries.
Yeah.
What would you like them to change?
If not the biggest.
If I am the pharmaceutical industry, you're talking to me right now.
Yeah.
What do you want me to change?
Well, I honestly don't think the drug industry themselves are going to change because you see and I've met, I debated the CEO of AstraZeneca at the Cambridge University Union in 2019. And their motion was that we need more new drugs, which effectively means we need more people taking more drugs. And, the information he gave was also very much tailored to the marketing of, for drug industry interests, for drug industry interests. But as a person, he seemed like a nice guy. Their obligation as CEOs is really only to their shareholders. So there's not very much they can actually do, to be honest, other than maybe think from their conscience, this is really bad, and I need to quit.
Aside from what they can actually do,
So I
imagine
don't
I'm
think
giving
they
you
can
a wish list. How would that wish list look like?
Okay, I think the first thing is, if let's say you suddenly get an understanding and a conscience, right, that you're from the information you've realized. Because I also think they probably they become blinded, I think, as well, to the negative aspects of their drugs. They just condition their brains to just, black out, if you like, any of the negative stuff and just think, okay, I'm doing something life-saving, I'm helping people. Let's just say that's what's going on psychologically with them, okay? Not malicious intent where we're going to deliberately hide data and lie, okay? There's evidence that that's happened, of course, but let's just take the argument that they are well-intentioned as well, but they realize suddenly this is not right. I think the first thing is that we should say, listen, we're going to get our amazing scientists, we're going to develop these drugs that we think are going to be amazing and helpful for people, but we realize that we've got a stake in this and we have a huge bias. So our drugs that we think are amazing and great, they need to be trialed independently, not by us, not by people who have a stake in the company or people who are funded by the company or the employees of the company, because that's what happens normally right now.
So right now the regulator is approving a drug based on trials that are paid by the pharmaceutical
designed,
company.
Analyzed by employees of the drug industry.
Okay.
And then the other issue is the regulator. You think the regulator is independent. They're not, right? MHRA in the UK, our regulator here, gets 86% of its funding from Big Pharma. 65% of the funding of the FDA in the US comes from Big Pharma. Huge bias.
How is that legal?
It's called corporate capitalism, my friend Alberto.
No, but it's a conflict of interest. It's like,
of course, it's a huge conflict of interest.
Exactly.
But this is what happened with this neoliberal economic model that was put through by Milton Friedman, is that what used to be publicly funded, even university research, for example, that money, got reduced because it was thought, we need to reduce government spending. So who then filled the gap? The industries that then were making huge amounts of profit through, obviously, over time through fraud. So, I'm all for people making money doing the right thing, but we've got a system, Alberto, where a lot of these actors, these big industries, have not made money through merit. They've made it through mass deception and exploitation and manipulation. They don't deserve to have all that money, because the other comeback will be, well, hold on, Dr. Malhotra, where are we going to get this money? If we want publicly funded, where are we going to get this money? Tax the fraudsters. Don't tax the rich, tax the fraudsters, which, by the way, happen to be the people who are the most rich, unfortunately. This is a huge injustice that's being inflicted on society and needs to be resolved through conversation, through information, through knowledge, because most people, I think, will realize this is unacceptable. But because they are so powerful, this is the challenge we have, Alberto, because they are so financially powerful, it has now become a tyranny. And, Jordan Peterson, the clinical psychologist, talks about this. He says, a tyranny emerges when people are afraid to say what they think. When you have something to say, silence is a lie. And when everybody lies all the time, the tyranny is complete. I know this myself when I've been so heavily involved in exposing what I think is the greatest medical mistake, may well turn out to be one of the greatest crimes against humanity of our modern lifetime, is the continued use and rollout of the COVID mRNA vaccines, right? It's causing lots of problems. Good independent data says from the beginning it probably shouldn't have been given to anyone because it was going to cause more harm than good, with a serious adverse event rate from their own trials of Moderna and Pfizer of 1 in 800, which was higher than the risk of being hospitalized with COVID, okay? So suggests more harm than good from the beginning. And the data's clear, and I've published on it, I've given lectures around the world, and people are on board. But most people, doctors, come up to me, they say, Aseem, we support you, this is a problem. Thank you for what you're doing, I'm too frightened. I've spoken to politicians, people in government ministerial positions. I've sat with them for hours, taught them through it. They completely understand what's going on by the end of it, and they're shocked. They even feel afraid to speak out, right? This is bigger than even a prime minister or a president, because the power of these corporations financially is even bigger than them. So what's the solution? It needs a collective approach. It needs everybody to be aware, and that's slowly happening, Alberto, to then suddenly there'll be a tipping point, that bubble will burst and people say enough is enough. And I think to some degree, we've seen things happening in the American election where, Bobby Kennedy Jr., who was originally running for president, decided ultimately to align himself with Trump because they weren't really getting him on the ballot, right? And I think he would have done very well. Millions of people, I have no doubt, and I know many people themselves, voted for President Trump to get Kennedy in there because Kennedy is willing to take on these big corporations. How did this happen, though? Is that what's interesting is a couple of things, I think, is the real world data and people experiencing more and more of the issues of side effects. There was one survey in the United States, a large proportion, maybe up to 50% of Americans felt the excess death rate in the US, okay, above average expected number of deaths per year, was linked to the COVID vaccine. So now, and the dissemination of that information has happened through real world experience. Like, hold on a minute. You told us this was going to protect us from getting COVID, first of all, 100% protection. Then you change the goalpost saying it will protect you from severe disease, right? So things kept changing. Then, we were told to stop transmission. Then we know it doesn't stop transmission. But people were so overcome by fear that they psychologically, I think, became obedient to the state power, to the state narrative, and were still able to remain obedient to the state narrative, even though the state narrative was just changing all the time and contradicting itself. But then people started to realize, hold on, there's an issue here, and they were experiencing side effects. And then the other, I think, what enabled the dissemination of this knowledge massively was less trust in legacy media, which is not good. I don't think that's a good thing. We need to trust our institutions. And more trust in alternative media, such as the Joe Rogans, the Tucker Carlsons, of this world, maybe the Stephen Bartlett's, what you're doing. So there's a huge shift happening. But the way to ultimately combat the injustice is what Gandhi said, is make the injustice visible. And this is what we're doing right now.
I feel like there's a difference in seeing change in the pharma medical drug industry than in the food industry, mainly from an educational point of view. So I think that almost everyone is aware that sugar is bad for you for one reason or another. Yeah. Also because it's easier to digest that, to understand it, and then to apply a change in your day-to-day life. But I think that you need to have studied medicine to be able to challenge that drug A, B, or C that your doctor has prescribed to you is bad for you. But also, there's another factor that plays a role here, which is the authority figure. It's both at a doctor level, but also in the case of the COVID vaccines at the government level. Yeah. I forgot the particular name of the study of the research, but there was a research in which they took a number of civilians, and then they put them in a case in which they distributed them into two different groups. Group number one, they were supposed to play the patient, and then group number two, they were supposed to play the authority figure. And then the group number two was told that you need to give these patients an electrical shot, and the voltage could go up to a specific level. Yes. And that level can also kill the patient, and so on and so forth. But
I think was it the Stanford prison study? I think something like that.
There were two of Stanford. Okay. The prison cell is a different one, but effectively the conclusion was that when there's an authority figure in front of you or present, and they're telling you to do something, all your morale, all your values, they go down the drain. And you end up following that authority figure. And that's what happened in this case. So almost everyone went to the highest voltage because they were told to do so. And in this case, they were told to do so by someone that was perceived as an expert, as an authority figure. So I think that if we extrapolate this example into the medical industry, or in particular what happened with the COVID vaccines, it was either the doctor telling you to take it or the government. Those are two very strong authority figures.
Absolutely.
How can I, as a civilian, as an average person, challenge that?
I mean, I think the first thing is just be prepared to listen to different sides and what people are articulating about what their views, and then join your own view, make your own view. It's not easy to challenge because, you're going to get pushback. You have to just think that by not speaking the truth that you believe to be correct, it's not safe to speak the truth often, but it's less safe to not speak the truth. So the problem's going to get worse. So you just have to then speak your mind and articulate in the best way you can. That's all I can say as a citizen. And, we live in a democracy. We can vote for politicians and people that we think are, putting our best interests first. And that's one of the ways that we can exert our influence over a corrupted system. You can write to your MP. MPs have to respond. I mean, that's one simple thing that people can do, is write to their MP saying, listen, what's going on here? This is not acceptable. This is what a lot of people did. Certainly people who oppose lockdowns, for example. Just coming back to your point about the compliance issue, it's very interesting because I just remembered there's a film on Netflix based on a true story, pretty horrific, but reinforces what you just said. It's called Compliance, if I remember correctly. And this is a story about a guy that, and I don't think they named it, but it was McDonald's, who was a fake caller that called McDonald's and identified, I think he'd gone in there, a young woman who was one of their employees, to say that she, I think, was stealing. And gradually through the conversation, and he came across as an authority figure, like a policeman. I mean, it got so bad that ultimately he got one of the, I think another employer, someone linked to the restaurant, to the fast food chain, to get this girl in a room and sexually assault her. And that, again, underlies what happened just from this compliance. He's a police officer. I mean, it's crazy. It's crazy, horrific. So yeah, it's something that's quite disturbing, really, that what can happen.
Also adding
in this
to that,
situation.
If we're trying to do something at an individual level, going back to what you were mentioning, the pushback, an individual is trying to tackle a big organization, so it feels like the resources against you are so big that there's nothing that you can do. Let's talk specifically about the pushback that you've suffered. It was in 2023. So a number of doctors, they gathered together and they recommended the GMC, which is the official regulator for doctors, to investigate you and basically determine if you were fit to practice, because you were disseminating all this knowledge, anti-vaccines, anti-mRNA vaccines, and so on. Then that turned out not to go so well for these doctors, because the GMC didn't proceed with the investigation. But in the simplest of terms, I've taken the mRNA COVID vaccine. My brother has taken that, my girlfriend, some of my family members. What was so wrong about it that you needed to speak publicly about it?
I think we were sold a lie that it was safe and effective. It wasn't effective in preventing transmission or infection. We know that almost very quickly. Okay, we have data clearly showing that it was never going to prevent infection from the beginning. We were told it was 95% effective, number one. Number two, the serious harm rates were very significant. And the original trials revealed that, a reanalysis published in the journal Vaccine, that it was going to do more harm than good from the beginning. That's horrific. It's awful. And it's not a small number. 1 in 800 is not a small number at the short term. We now have emerging evidence suggesting that it, through some sort of immunosuppression, especially people who've had boosters, that it's increasing the risk of cancer. So there are a lot of uncertainties, but we have certain good, strong evidence that it was extremely harmful. And should, in my view, Alberto, shouldn't have been given to a single human being in the first place. Talking about, this magic wand about the system changing and independent analysis, if the system was in place that allowed independent evaluation of drugs, like something I campaigned on for many years, even took it to the European Parliament in 2018 and, gave a lecture there, which is called Big Food and Big Pharma Killing for Profit, and got some media coverage on it, and have been calling for this for a long time. If that system was in place, it wouldn't have passed the approval process at all, because the serious adverse event rate was going to be too high to mass vaccinate, tens of millions of people, hundreds of millions of people. So it's really unfortunate. It's a really unfortunate situation. As a cardiologist, as an expert in cardiology, I had to learn a lot more about vaccines, which I didn't know because that's not my area of expertise, and then spent months researching it and then writing up in a journal. The thing that I identified, which troubled me most, is the fact that there's good mechanistic evidence and other data to support that it causes inflammation of the coronary arteries, which would drive heart disease or accelerate people who had a bit of mild furring that may not affect them for 20 years. Suddenly they're having a heart attack in a year or two. So this, and it's something I've also diagnosed with my patients, where we've had patients who have had a coronary angiogram and got what we call stable, 20% narrowing or something, which is not, mild. More than 70% is severe. And then 9 months later, they've come back with chest pain, gone back in, they've had an angiogram, and they've got almost 90% blockage, which is very unusual to have that kind of degree of acceleration. Everything else is stable. They're taking their meds appropriately. Lifestyle is good. And the only difference is that in that space of that 9-month period, they've had 2 mRNA vaccines, Pfizer jab. So I've seen it in my clinical experience. We've got mechanistic data, published data, showing it increases inflammatory markers in the blood, certainly for up to a year. And that's a really, really, unfortunate situation we're in. So what we've done is, in effect, and I've written to the GMC about this, is that it appears that we have mass injected into hundreds of millions of people a carcinogen, something that can cause cancer. Now, to what degree, that needs to be determined, but it does certainly need to be carcinogenic through suppression of the immune system, that also causes heart disease, is causing autoimmune conditions to flare up. I sometimes wake up in the morning hoping that this has all been a nightmare. This is truly horrific, Alberto, and it pains me. It pains me. I have been suffering from clinical depression for the last almost a year and a half. I'm not taking meds for it. It's mild. And, part of it is to do with, of course, having to deal with these sorts of threats to my career. People kind of go after my medical license. But I think a large part, I realize now, is just the pain I feel of the fact that all this suffering is going on and still going on, and it hasn't been stopped.
Since you started campaigning, have you seen any change, any progress?
Huge. 85% of NHS staff, and I think this figure is similar in the United States. Think about the doctors and nurses, despite being told to have their booster, are refusing. What does that tell you? There's much less uptake. And just to give people perspective now, in terms of the benefit of the COVID vaccine, it's a very, very tiny benefit to a point where if it wasn't such a serious issue, it would be laughable. But the actual benefit, for example, the highest risk group now is people over 90. And you have to basically vaccinate over 7,000 of them. And this is, again, data which is not the most robust, but gives you a ballpark figure. You have to vaccinate 7,000 of them to prevent one of them being hospitalized with COVID. Roughly that number. With a serious adverse event rate of at least 1 in 800 in the short term. And patients are not being told that. People have conversations and patients come to me saying, what do you mean the statin is a 1% benefit? That doesn't sound very good. We're talking about thousands of people having to be vaccinated if the vaccine is effective at all. And again, this is still data which isn't clear, but gives us an idea. It's unbelievable. And the authorities, the willful blindness. I mean, let's also try and understand and have some empathy. It's difficult with the people who are not doing anything about it. It's a lot for them to take in. I met one former very respected, I won't name him, senior government minister, Conservative Party when they were in power, spent 2 hours with him. He completely understood and believed what was going on and listened to me and believed me. And he basically said to me, he said, Aseem, this can't come out before the general election because it will collapse the government. That was the reply. Not that, So this is an issue that we have a crisis of morality as well in the world right now. People in these positions of power, in medical institutions, leading medical, doctors, and I know a lot of these guys, right? I've worked with them. Politicians, it's a cultural problem. We're all part of it. And I come back to this, who has the greatest influence or power over our lives at the moment, over our culture? It is an entity that is being described as psychopathic. So this is what we call a downstream effect. I'm not saying everyone's a psychopath, but if you think about that, it's going to affect our morality. Actually, it's going to stop us from behaving virtuously, and we can't. I mean, you can't achieve also optimal mental well-being unless you're actually acting from a place of virtue as well. History tells us that. Modern psychological research tells us that as well. Somebody who acts from a place of honesty, truth, justice, courage, psychologically, they are much better than people who don't. So it's lose-lose, but we have solutions. So we have to go back to square one, That's it. Very simple, basic ethics. I wrote to the GMC, and one of the things I I had a role. I was the youngest member to be appointed to something called the King's Fund. It's an organization that advises government on health policy. It's a think tank, very prestigious, very good people in there. And when I joined the King's Fund, it was very interesting. I had to sign this. I was one of the youngest members to be made a trustee, and I had to sign this document, as I joined. And I loved what they wrote. And they talk about something called the 7 Nolan Principles of public life, which is principles that every person that serves the public, for specifically teachers, doctors, police, politicians, should adhere to. And there are 7 principles of how you should act. And they are selflessness, objectivity, integrity, accountability, honesty, openness, and leadership. And leadership also means calling out bad behavior when people are not adhering to those principles. I think that most people in leadership positions are not adhering to those principles.
I cannot think of any leader in today's world that is fitting any of
There's
those
one
categories.
that, for me, does actually fulfill those criteria, but he's not in this country. Without a shadow of a doubt. I'm sure there are people here that don't come to my mind immediately. But one person that definitely fulfills all those criteria is Robert Kennedy Jr. I've known this guy for a few years, and for me, he epitomizes that. He epitomizes what his uncle JFK and his father, the late Robert Kennedy, also the way that they became such popular, prolific, amazing political figures is because they were genuinely in those positions because they wanted to serve the public good.
Your mission is to seek transparency and justice, in a nutshell. Do you think this can be accomplished within your lifetime?
I would certainly hope so. Definitely we can make progress. And it's always about evolution, moving more and more. We'll never achieve utopia, but we should at least strive for it. But my view, my philosophy is really to devolve the ego from this, is that when you speak the truth, you got to let go of the outcome. But honestly, I hope so. And I believe we can.
Dr. Malhotra, Aseem, we've discussed so many different topics related to health or heart, medication, the different institutions. If you had to compress all your knowledge into one single advice that we should implement in our daily lives to improve our heart health, what would it be?
I can only give one advice, huh? I think the most important thing right now for heart health and other disease is that's the real issue is eat real food.
Whole food.
Eat whole foods. That's it.
Thank you. Thank you not only for coming, but thank you for your bravery. Because you are taking on one of the biggest giants our world has ever seen, which is the pharmaceutical industry, along also with the food industry. And in particular in the pharmaceutical industry, I believe that the average person doesn't have the right technical knowledge and also the bravery to go up against it. But you do. So I thank you on behalf of everyone that will benefit from this. Also, we're going to leave a link in the description to 2 of your books that I started reading. One of them is the 21-Day Immunity Plan. And then the other one, which is the one that I was super curious about, is the Pioppi diet.
Lovely.
So thank you for your work.
Thank you, Alberto. Also, thank you. I just add that I see myself as a medium for a message, and there's some of my influences. I'm just part of a movement. So I think, we collectively will overcome this, but thank you. And if people are also interested, one of of getting more empowered education on the lifestyle plan, on the stress, on the cholesterol, the statins, on a diet plan that's going to work for them, I've just started a program with a nutritionist called Metabolic Reset. So they can go to, have a look at that. And again, it's just £25 a month. But it's empowering knowledge as well, that they become experts almost in their own health around cholesterol and drugs and diet. The website is metabolicreset.co. So yeah, that's
we'll
another.
Put it in the description too.
Okay, great.
Thank you.